We were really facing the eye of the storm. We couldn't keep up. It was just nonstop.
You're fighting an enemy, so it is like a war. And we have teams of very brave people fighting that war every day, day in and day out.
We probably average 6 to 8 deaths in our department every single day.
I think the hardest thing was not having anything to tell the family.
We often think about our healthcare workers as being very resilient, very capable of dealing with tense, stressful situations. With the COVID pandemic, this cumulative effect of the stress was starting to add up, particularly for healthcare workers, who represented a vulnerable population actually during this pandemic.
They get the family on the phones to make a phone call to say their goodbyes over Zoom.
It is incumbent upon us to provide the kind of healthcare to our healthcare warriors to help them deal with this trauma and stress.
As COVID was continuing to increase in the New York City area, we saw a significant need to try to use technology to try to address this pressing health crisis. And the Warrior Watch study really represents this in its purest sense.
Using data from Apple Watch, researchers are studying the impact of COVID by identifying early signs of stress, while also looking to predict infection before symptoms appear.
We wanted to really honor our frontline healthcare workers for what they have done during the COVID pandemic. We designed a specific app. We'll be following healthcare workers to try to monitor physiological measures such as heart rate variability, sleep disruption, and activity to understand better the level of anxiety and stress they are faced with, the effect of chronic stress on the brain, but also on the cardiovascular system and on the immune system.
What we found actually is that from the markers we're getting from the watch, we can identify COVID infections. But more interestingly, we can actually predict their development and identify them several days before people are actually either developing symptoms or having a positive COVID test.
We're dealing with COVID-19 right now, but this is not the last crisis that we are going to be facing moving forward.
When you look at the impact that Mount Sinai has made in the face of COVID-19, it's been expansive. The Warrior Watch project is just one of the many unique things that we're doing here at Mount Sinai, but it typifies some of the innovations we've had, not only in this particular area of digital health, but in all areas of COVID-19 research.
Our experience here at Mount Sinai during the pandemic can really be leveraged and be useful for other healthcare systems within the United States and worldwide to fight COVID and to fight any new pandemics that might arise in the future.